All right, it is 2 o'clock on the dot. So we are going to go ahead and get started. It is great to see you all here today. I'm Janet Wall, and I am the CEO of both the Virginia Nurses Association and the Virginia Nurses Foundation. And again, we're so pleased to have you here this afternoon for our first lobby hour. We'll discuss the nursing legislative priorities, our public policy platform for 2022. And a brief reminder that as we do at all events, we ask everyone to adhere to the code of conduct, which you can see on your screen. And I think it was also provided to you upon registration. Additionally, if you would like to turn on your webcam, please do, but please keep your phone line or your line muted so that we don't have the background noise that sometimes interrupts our programs, but feel free to jump in at any time with your questions. And this afternoon, we're going to provide an overview of nursing's public policy platform and discuss various advocacy tools you can use during this session. And we'll end the discussion with a Q&A. So please send your questions to us via the chat feed as well, if you'd prefer to do that rather than shouting them out.
There you go.
And now I'd like to introduce VNA's Commissioner on Government Relations, Ashley Apple, to talk to you about our public policy initiatives for 2022. Ashley, take it away.
Thanks. Thank you so much, Janet. And I'm so happy to see that so many people are joining us today. So I'm Ashley Apple. I'm the Commissioner on Government Relations for the Virginia Nurses Association. I've been a nurse for about 13 years. I spent about a decade in the ER, and then I became a family nurse practitioner. And now I work as an NP in PEDS urgent care. I also teach at the UVA School of Nursing, and I'm passionate about health policy and advocacy. So I'm super excited to tell you about all the good work we're doing on behalf of nurses in the Commonwealth, help to prepare you a bit for some policy and advocacy involvement, and get valuable feedback from all of you to help guide our work moving forward. So in recent years, we developed what is now called the Virginia Legislative Nursing Alliance. It's composed of leaders from nursing organizations throughout the Commonwealth. And I'm excited to say that it continues to grow in both size and engagement. And as you can see on your screen, all of the groups that are participating. And the purpose of the group is twofold. So it's a great opportunity for all participating organizations to discuss their legislative priorities and become familiar with each other. And two, this group identifies the priorities, the 4 to 6 priorities that will be included on nursing's public policy platform. Before I begin, I do want to mention the issue that is at the forefront of everyone's minds, I think, right now, which is the burnout and the trauma nurses have faced due to the COVID-19 pandemic. So VNA is working with our partners and other organizations to develop potential legislative solutions. But to the nurses in attendance, what would you like your legislators to know about what the last 18 months have been like? So we invite you to share your experiences in our chat feed, and I'll pause for just a minute so you can do that. Just take a minute and pop it in the chat. Tell us what it's been like for you, what you want your legislators to know about. All right, and so I'm going to talk a bit today about our 2022 nursing public policy platform. So the first thing, continue funding for the Virginia Preceptor Incentive Program. So we're aware that there's a kink in the pipeline for nurses who want to become advanced practice registered nurses. The universities are eager to accept more students into their programs, but lack of preceptors has made this really difficult. And so thankfully in 2021, the General Assembly gave us $500,000 to the Virginia Department of Health for 1 year to provide financial incentives for otherwise unpaid preceptors who would provide hands-on clinical instruction. And so these preceptors could be physicians, nurse practitioners, or physician assistants. And this program can make a huge difference, particularly in underserved and high demand areas like primary care and mental health care. And so our ask is to continue the funding during this budget biennium. And in fact, the governor's proposed budget does include about $1 million for this. So that's fantastic. And we look forward to continuing to fund this program and continuing to help create more advanced practice nurses to meet the needs of our communities. All right. And then so next we have advanced legislative solutions that create and sustain conditions that support the health and well-being of all Virginia communities. There we go. Okay, yeah, that's the right slide, cool. So the COVID-19 pandemic has exacerbated already existing issues of mental health care, access and health inequity in Virginia. And all Virginia communities deserve the opportunity to live in a state of well-being and have access to safe and affordable health care. To ensure the optimal health of our citizens and communities, we have to ensure that wellness is factored into decisions related to everything under the sun, the social determinants of health, right? So education, employment, housing, transportation, land use, economic development, and public safety. And so we plan to work alongside with government partners and other agencies to support legislative solutions that promote effective health and tackle barriers to wellness, particularly looking at mental health and health equity within marginalized communities. It's essential that the wellness of the whole person and all persons be factored into these decisions. And so that is definitely a top priority this legislative session. All right, and so the next item on the policy platform, reduce unnecessary practice restrictions. So the pandemic, as horrific as it has been, has also presented us with some learning opportunities. One of those relates to the transition to practice for nurse practitioners. In other words, how long they need to practice under a collaborative relationship with a physician before transitioning to autonomous practice as nurse practitioners. So during the pandemic, Governor Northam issued an executive order reducing the prior practice agreement, which was 5 years, reducing that down to 2 years. And it worked. We actually have lots of data coming in, studies that have been done in the Commonwealth about how well we're providing services. And we know from this huge volume of data from all over the country that nurse practitioners provide high quality, safe care, and they can help expand access to care in our communities. And so we're encouraging the legislature to make this change permanent. Let's see, in fact, oops, sorry, I lost my place. Yeah, we're encouraging to make it permanent. And in fact, tomorrow, this bill will be heard, the bill that would extend the collaborative practice period to maintain it to be 2 years. It'll be heard tomorrow in one of the committee meetings, and we'll talk more about that. But we're really looking forward to input from everyone, and we'll tell you how to sign up to give some input on that bill for the committee meeting tomorrow. You can give some written testimony if you'd like. Let's see. So next,
resources to work with our leaders to improve what happens once these individuals get into their department. That's where more to reinforce.
I hear some background noise, and I can't tell if it's someone speaking to us, but just a reminder for everybody to mute their microphones, unless that was directed at me, in which case I'll need you to speak up. But
I was wondering too. I don't think it was. I muted the line.
Okay, great. Thank you. I appreciate it. All right, so extend COVID-19 presumption for healthcare workers. So the COVID-19 pandemic shows no signs of slowing down. I mean, we're still teetering right here on the peak of Omicron, and we have obviously emerging variants to be concerned about. You know, it's really important that we help protect and take care of our frontline healthcare workers. And so legislation was adopted in 2021, which provided a presumption of work-related infection for healthcare professionals who contracted the virus through their work with confirmed or suspected COVID-19 patients. You know, at the beginning of the pandemic, before this existed, the burden was on nurses, was on frontline healthcare workers to prove who they got the virus from, and when it occurred, and what, you know, personal protective gear they were using, you know, at the time. That was really problematic. In the beginning, we didn't have access to tests, and not everybody even, you know, met criteria to use those tests, even if they were symptomatic. And so proving who you got a patient from is really difficult if you can't prove which patients have COVID. And then the opposite happened. As the COVID became more prevalent, then all the patients have COVID, right? And so isolating the exact patient that gave you COVID is really difficult. And so this piece of legislation extended a presumption to healthcare workers to frontline workers that said, if you get COVID, you don't have to prove which patient you got it from. We will presume that it came from working on the job. And what it did is it granted access to workers' compensation benefits for frontline healthcare workers. We're really proud of this piece of legislation that moved through, and we applaud the General Assembly for passing it. But as we know, the pandemic rages on. This is not something that is going anywhere anytime soon. And so we're asking to have this extended in the 2022 legislative session. And so far, so good. There's lots of work to be done. But yesterday, it did move out of a subcommittee unanimously. So we look forward to hopefully having this continued and getting the support of the full legislature to do that. All right, so the next policy item, let's see, registered nurses in public schools. And I'm sorry, I'm making you jump around on the slides. I think maybe mine are out of order from yours, but let's see. So RNs in public schools, we need them now more than ever. First of all, we know that the school nurse is often the only healthcare professional that students have access to. And so it's really important to have registered nurses and the broad scope of skills that registered nurses bring to the school setting, performing assessments on kids. Certainly with COVID, it's important that they need to be able to assess patients, triage them, isolate students who may be infected or showing symptoms, and perform contact tracing. And these are all skills that are really specific to registered nurses. And so we're pushing hard to have registered nurses in all public schools. We think it would be a great thing for the community and for nurses. Let's see. So clarify prescriptive authority for clinical nurse specialists. So in 2021, legislation was passed that provided CNSs with prescriptive authority and added Board of Medicine oversight in addition to Board of Nursing oversight. And as often happens, or sometimes happens in policy, there was an unintended consequence of this change, which because of the verbiage in the law, it implied that CNSs had to enter into a practice agreement, regardless of whether or not they wanted prescriptive authority. Many CNSs do want that, but not all do. And so we're just clarifying that language in the law to make sure that CNSs who don't want to prescribe medications are not required to have these collaborative practice agreements, which are can be really expensive and sometimes difficult to get. So, all right. Cool. And so that about does it for the actual policy platform. And so, so we'll move right on to bill tracking. So we have an amazing lobbyist at the VNA. His name's Andrew Lamar. He's awesome. He's my wingman, and but he's fantastic. And he's put together this this website that you can access. It's called Fast Democracy. And when you pull up this website, you can look and it'll show bills of interest, bills that relate to our policy platform. It tells you who the sponsors of the bill are, who's introducing the bill. It tells you what the bill does. It tells you the most recent action on the bill, like, where it was heard, when it was heard, what happened. And there's a little button you can even track this bill, in real time during the legislative session, so that you can get updates about bills and really see how things are moving through the legislative session in real time. This is really an amazing thing to have access to. And we're so grateful to Andrew for making that happen. So definitely something you should copy paste that web address. And I'm sure we can probably share it with you in the chat if that makes it easier. And keep this so that you can refer back to it and just see what's happening in the legislature during the session. All right, so virtual advocacy tools. All right, so stats to remember. So the VNA, right, represents all nurses in Virginia. There's more than 115,000 registered nurses in the Commonwealth. Nurses are the largest population of healthcare workers. Approximately 1 in 80 Virginians is a registered nurse. And in addition to just having high numbers of nurses, for the 20th year in a row, nurses are ranked as the most honest and ethical profession. And that's a lot of public trust that's placed in us. And so it's really important to remember that there is power in numbers, right? So there's a lot of nurses in Virginia, and we are really trusted. And so for this reason, we can have a huge impact on advocacy work, on health policy. And so remember that, and remember to let people know when you're advocating for something that you're a nurse. There's a lot of us, okay? So the Gallup poll has been conducted for like 20 years in a row, and this just shows you that nurses are the most trusted profession. So, please tell me how you would rate the honesty and ethical standards of people in these different fields. And nurses, boom, right at the top. And this is 20 years running. With great power comes great responsibility, right? So we need to make sure that we utilize this trust to really do some good for the profession and for our communities. And there's all sorts of ways that you can advocate, particularly in a pandemic. People want to listen to nurses, at least we hope they do. We think they do. So you can certainly look at the VNA website. We update that often with different, it's got the public policy platform on there and different legislative issues that have come up. So that's a great resource for advocacy. Social media sharing is really important, right? I don't know about you guys. I like social media. I spend a lot of time on there, killing time, scrolling, the endless scroll. Well, that can have a big impact on sharing information related to advocacy, and just sharing things on social media, sharing VNA posts, sharing information on legislative issues that are important to you, expands the reach, and it allows other people outside of our little nursing bubble to see what we're up to, see what we're doing, and see what's important. Email, and and it also helps to share things with legislators, because you can tag legislators on social media to get their attention, right? So this is another way of sort of escalating your voice and extending your voice larger than just your own circle and just your own friend group. You can also do this by email or by telephone. You can email legislators, you can email other stakeholders, people who have an interest in the particular issue that you're interested in, to build support. You can make phone calls. You can make phone calls to your legislators, to other groups, to other people who are interested in the issues. And there are lots of in-person meetings. Zoom meetings are happening. And in fact, there's a virtual option in the legislative session where you can actually, members of the public can provide input on bills of interest virtually through Zoom. So lots of great ways to connect on advocacy. All right, so super important. I love this website. In fact, I do, I teach obviously, and I do lots of health policy talks to students, to nursing students. And I always have them go to this website. It's Who's Your Legislator? And it's a pretty easy website to check out and remember. But if you forget the web address, literally all you have to do is Google, who is your legislator, or who's my legislator? And it'll pop up. It's a website that gives you immediate access to who all of your legislators are. It's really simple to use. All you have to do is fill in your address, and it'll show you all your legislators. So state legislators, federal legislators, and even better than that, it pops up with their little faces, and all you have to do, one click, boom, send an email. This is a really easy way to get in contact with your elected representatives. You can use this website. And then for members of the VNA, we also have the VNA Legislative Guide, which will give you some inside scoop on which legislators are supportive of nursing and how to contact them, and on things like that. All right, and very importantly, we want you to stay informed with VNA Action Alerts. So you can do that by going to the web address that you see on this slide, and just pop in your information, and we'll send you action alerts. We are not going to pester you to death, I promise. We're not going to over contact you. We're going to send you just the right amount of information that tells you about all the legislative action that's happening. If we need to mobilize nurses, on a particular issue, this is the way we do it. And so if you are interested in advocacy and getting involved, we absolutely encourage you to sign up on the VNA Action Alerts so that you can stay informed. All right. So as I mentioned earlier, we were talking about House Bill 1245. Now, this is the piece of legislation that's going to extend the 2-year collaborative practice agreement for advanced practice nurses, extend that into the future. It was a temporary measure, and we want to make it permanent. And so it's going to be heard, let's see, tomorrow in committee, in full committee. And so we would love for you to share your voices in support of this legislation. So in order to tell your delegate that you want them to vote yes, you have to make your contact by tomorrow at 10 a.m. Okay. And please do that. Remember, you can go to the Who's My Legislator website, pop in your address. It'll show you exactly who your legislators are, click email, and then tell them what you think, okay, about House Bill 1245, which hopefully is that you support it, because we do support it. Great. And I think we just popped that in the chat for you. So you can click that website if you need help doing that. All right. So as I mentioned, social media is a fantastic advocacy tool, and it works when you do it right. So even if you're not particularly active on social media, you can get active in order to use this as a tool for advocacy. Get your feet wet. So it does help if you do it correctly, and there are things that you can do to give your social media presence more impact. Follow organizations that are leading legislative efforts of interest to you. Follow the VNA, for example. Most importantly, follow your legislators, because they give updates all the time. In fact, let's see, Tim Kaine just today posted an update about a big grant that was given to UVA to look at moral distress and burnout among nurses in the pandemic, right? And I wouldn't have known about that if not for the fact that it was posted on social media. I mean, I eventually would have found out, but probably not as quickly. So following your legislators is a great way of staying informed on what they think about the issues. And it's a way to engage with them, comment on things, and express yourself. Share the information that they post. If your legislator is being vocal and supporting an issue that you support, you can share that post with your friends, with your friend group, share it publicly even, throw some hashtags on there so that it gets more views, right? By doing this, like I said, you're sort of expanding your reach in terms of getting the word out to others just outside of the nursing bubble about what we're trying to do. If you are sharing information, if you are sharing information about our advocacy efforts, please make sure to fact check, right? Remember, we are relied upon, we are the most trusted profession. It's really important that the information that we share, particularly related to advocacy, that it's factual and that it's accurate. And this can be done in just a couple of seconds. And hey, I love fact checking, so I'm happy to help, okay? Just make sure what you're sharing is legit and that it's factual. Use hashtags, provide facts, and share a story. Your personal story as a nurse is compelling. People want to know what you're going through. They want to know about your perspective, and it really adds a personal touch to the things that you're trying to do legislatively. All right, calling. So sign up for emails from organizations working on legislation or areas of interest to you, and they can even provide a script, a really easy script to follow. They tell you exactly what to say when you support a particular bill or oppose it. And sometimes all you need to say is, I'm a constituent and I'm calling in support of House Bill, 1243? I think that's the right number for tomorrow, or any House bill. They know what the House bill numbers are, and you can access that information online. You just say, I'm a constituent. There is power in being a constituent, being in someone's voting district. You elected them, and so your constituency has power with them. So always tell a legislator, if you're the constituent, tell them that. Make sure they know that you are in their district and that you vote. And again, remember to fact check any information if you're sending to legislators, make sure that it is accurate. Do a quick fact check, Google it. Meeting your legislators. So much of what we do in policy and advocacy work has to do with building relationships. This is a really important concept. So getting to know your legislator, and yes, you can totally do that. That's what they're there for. That adds power to your voice, right? It helps you to work with them moving forward on a whole host of issues. So establish a relationship with them. Serve as a resource to your legislator on multiple issues, right? We're nurses, we have lots of nursing expertise, and so we can provide that expertise to our legislators. That's valuable information. They don't know about nursing. They don't know about public health in the same way that we do. And so we can be a resource for them, and they will recognize the value in having that. So like I said, most legislators are not RNs. They want to know what their constituents feel strongly about, and they welcome subject matter experts to share knowledge on legislative issues. So how do you schedule a meeting? Call your legislator's office. You go to the Who's My Legislator website. In addition to linking you to an email, it also links you to phone numbers, to contact information. Give them a call, ask to speak with the appointment scheduler. And when you do go to meet a legislator, you need to be a constituent. You're probably not going to get an appointment if you're not. So, but call and ask for an appointment. We do have VNA lobby days, sometimes that's in person, sometimes we've had to do lobby days more virtually. But through these lobby days, also often you'll need to schedule your own legislator meetings. So that's why it's important for you to know how to do it. And sometimes if you can't schedule a meeting in advance, sometimes you get lucky and you can pop by the office and catch them if they have a few minutes. Of course, they're very busy during session, but sometimes you get lucky. Best thing to do with scheduling is be flexible on the dates and times that you can meet, because obviously they're busy. So you got to find a time that works for both of you, and be prepared to provide the scheduler with the number of people who are coming. So is it just you, or is it you and your posse? I wouldn't take a big posse. I would take just kind of a small, we don't want like 1,000 people trying to cram in the room, but tell them the number of people who are coming, a short summary of the purpose of the meeting. If you're too long-winded with the scheduler, they're going to be like, whoa, we don't have time for all that. Give them a brief, succinct description of what you want to talk about and the names of the people that are going to be coming with you. All right, and so you want to prepare for the length of time. So a typical meeting when you meet with the legislator is like 15 to 30 minutes or so. And so during the General Assembly, especially in virtual sessions, meetings are sometimes much shorter. And the schedules can change really quickly. So I always say, have your full big pitch, what you would love to say if you have your full amount of time, and then also have your elevator speech prepared, right? So you're down and dirty between floors 1 and 12, how you can really be succinct in case your meeting time gets really, shortened because of a busy schedule. You still know how to communicate your points quickly. And be ready to meet with a legislative aide. They are gatekeepers. They are an important resource and influencer of your legislator. So it may not always be possible to meet with the legislator. You might end up meeting with a legislative aide, but believe me when I say these people have lots of power, okay? Lots of power in that they help to shape what legislators pay attention to. They have a big influence. And so if you do a good job talking with the legislative aide, they're a lot more likely to convey that information to your legislator. So important to build relationships there. So what do you say in the meeting? First, you want to identify the main message. Be clear and concise. What is it you're asking? Talk about the specific bill. Have the bill number ready. I came to talk about this specific bill. Become informed on the ation. So think about it from multiple perspectives. Your own perspective as a nurse, how other stakeholders might see that, or what their perspective might be on the issue, and how you can speak in an informed way about all of those things. You ask your legislator to take an action, to do something. I want you to vote yes on bill XYZ, or I absolutely do not want you to vote yes. I want you to vote no on bill XYZ. And anticipate some opposing arguments, right? So your legislator may say, well, I don't really feel like I can support that because of this, this, and this. And if you've done your research, if you're informed on the issue, you can speak to any of those opposing arguments. You can sway or potentially sway how your legislator thinks about it. Be clear and concise. Know your ask before the meeting. Know exactly what you want to say. And if you're going in a group, definitely designate a leader, the person who's going to, probably the best communicator in the group, right? The most confident person to open and close and deliver leave behinds and to keep this discussion moving. It's good to have a leader. And then practice, because you don't want to get in there and be nervous and then be stumbling over your words and things like that. You got to be confident about it. And the way to do that is by practicing in advance. All right, so what helps to make a meeting successful? Well, of course, you want to dress appropriately. Business casual, right, is a good, or business dress is a good approach. I will say there is definitely some impact to be had by wearing scrubs, lab coats, and clearly identifying yourself as a nurse. But please don't wear the ones with all the bleach spots, okay? Wear the best scrubs you've got. Wear the nicest lab coat, fresh and crisp. You want to look like a nurse, like a very well-groomed, very smart nurse, okay? Make a good introduction, emphasize that you are a constituent, note any organizations or any institutions that you belong to or represent. So if you're speaking in support of something, something on the policy platform for the VNA, you can tell them, I'm a member of the VNA and I'm speaking about, our policy platform in support of this bill. So let them know, because remember, there's power in numbers. So identifying yourself as part of a big group with a lot of voting power makes your voice more interesting. Mention any other ties that you have, social, family, business, etc., to the lawmaker or the legislation, or emphasize your connections. And then most importantly, share a personal story, how you've been personally impacted by the issue. Yes, we want to come with our evidence and our data, when we talk to legislators, but we also want to make them see the human side in what we're advocating for. And your personal story is powerful. That has power with legislators. Start on a positive note, if possible. Thank the member for something. Thank you so much, Delegate Adams, for being such a champion of nurse practitioners throughout the years. I really appreciate all of your work, right? It's a great way of starting. I mean, who doesn't love a little bit of flattery and gratefulness? So, so the legislator is supporting legislation that helps the nursing profession. Start by mentioning this. State things clearly and concisely, your issue, your position on the issue, know your legislator's party and how that may impact their decision-making. As much as we love and we certainly like bipartisanship, we do know that oftentimes legislators, the way they vote on a bill, or the way they approach looking at a bill is going to be impacted by what the rest of their party is doing. And so anticipating that is really important. And follow up with facts. Provide facts that support your position and include a leave behind. For VNA lobby days, attendees, facts supporting our legislative agenda are often provided. And so it's really helpful to have a cheat sheet, that has some facts. And certainly, if you are striking out and doing advocacy on your own, it's never a bad idea to have a really brief cheat sheet in your pocket so that in case you forget an important stat or something, you can super quick pull it out and answer a question for a legislator and give them the answer, and that will impress them that you have that. All right, don't forget to listen. Allow the legislator to respond and ask questions. Remember, part of convincing someone to share your point of view or to vote the way you want them to vote means listening to them and hearing their reservations and helping to walk them through that. You have to listen to them to be able to address concerns. And don't answer what you don't know. Remember, we are a very trusted profession. It's important that we maintain that credibility. So if you don't know the answer, it is never wrong to say, I don't know the answer, but I'm going to find that out for you. In fact, as a nurse practitioner, sometimes I even do that at the bedside. I can't tell you that right now. Hang on a second. I'm gonna get this data and I'm gonna come right back and I'm gonna tell you the answer. And I'm gonna make sure that the answer I give is correct. And end with a direct question. Can we count on you to support our bill? That puts the onus on them to say, and sometimes they won't say. I mean, I'm not gonna, I won't pretend like they will always be like, yes, you convinced me, and yes, I'm doing this. But sometimes you will get an answer, and it's fantastic to know that you have the support of this legislator. It puts them on the spot to figure out what their position is by asking that question. And then most importantly, say thank you. Thank you for your time. Thank you so much for your service, in the legislature. All right, so after the meeting, write down impressions and do it right away. Your brain gets foggy as things get more distant. So while it's all fresh in your mind, take some notes about how the legislator responded, what happened, if multiple people were there, have a quick debrief and figure out, how did we feel that went? What did you notice? What did you notice? And the VNA will provide comment sheets for lobby day attendees. And then that way you can share some of your observations with others, because that can help with strategy, right? If we know how a legislator reacted to your conversation, that helps us kind of predict a little bit how they might vote on it. Certainly if they answered that question, can we count on your support? Well, that's important to know. And you definitely want to send a follow-up letter. So you want to summarize your key points and any commitments made by the legislator. If your legislator said, yes, I'm going to support that bill. Oh yeah, that needs to go in the note. Thank you so much for committing to supporting this bill, right? And you want to include any follow-up information that, if you said, I don't know the answer, but I'm going to get back to you, make sure you get back to them. You can include that in the letter, summarizing the data or research that you found to answer their question. And then, of course, let the VNA know how it went. ebook@virginianurses.com is a great place to send your comments, impressions, scoop. If you get any scoop, share it with us, okay? All right, so know before you go. The local angle, how does your issue affect your legislator's district or state, right? This is important. Legislators make decisions on how it impacts their constituents, how it impacts their district. And sometimes their districts are really wonky. We just reshaped a lot of the voting districts in the Commonwealth. We sort of redid our map, but I mean, there still are some districts that, spread from north to south, east to west. And so a large area of people with different interests. And so you need to look at who is in that district and think about how that might impact the way a legislator sees a particular issue. It's important to know that you can also do that through the Who's My Legislator website, right? You can actually see the district maps and see what it includes. And maybe what hospital systems are included in that district or things that are important to know. But know before you go, like we said, you want to know your legislator's party. You want to know what committees they sit on. So as you know, or may or may not know, as a bill becomes a law, it's introduced, right? And these bills all go through committees. They go through like Health, Welfare, and Institutions Committee or the Senate Education and Finance Committee, all of these committees. And the committee has to approve it first before it's presented for a vote in the larger legislature. So knowing which committees your legislator sits on helps you to know how much power they have on an issue, particularly health issue. That is also something you can find through the Who's My Legislator website. You want to know their background or profession, right? If your legislator is Siobhan Donovan and she's an MD, that's important to know before you go in there talking about a medical issue, right? You want to know their background. And if you're discussing a specific piece of legislation, know who the bill patrons are and thank your legislator if they're one of them, right? So the bill patrons, that's something that we will certainly share with you, but is also information that you can find on the internet or through the legislative websites. And be sure to thank them if they are a patron of the bill because they're helping us. All right. So I know that was like so much information to throw at you guys, and I hope that it was really helpful. I hope that it helps you to think about how you can advocate and gives you some really solid steps on how to prepare, how to conduct, meetings and how to advocate, and then how to follow up and how to inform yourself and inform your legislators. And so with that, I would like to open up, I think we'll do some Q&A now. And so let's see. Ms. Buck, are you gonna ask comments from the chat or would you like me to review them?
Ashley, if you wanted to go ahead and read them out loud and answer them, that would be excellent.
Sure, I would love to. All right. So let's see. I see some of in the beginning of the chat, people were piping in about when I asked about your experience during COVID, and we're talking about burnout. And so I see lots of good comments, and I definitely want to take some time and read through those. Let's see. I do see someone mentioned the discrepancy between staff and travel nursing pay and the effects this is having on staff nurse retention. You're absolutely right. This does have an effect on staff nurse retention. If you're doing a job and you see a nurse, working next to you doing the exact same job, but making 3 times as much money, that can be a bit demoralizing, right? And, I think it's important to note that the VNA, we have done a good job of letting hospital systems know and letting people know that this is demoralizing and this does add to sort of the burnout that nurses are experiencing. Not only that, but why would you stay in a particular clinical setting if you feel like you can go somewhere else and make a whole lot of money. And so this has big impacts on our ability to keep qualified staff in the Commonwealth and to make sure we have enough nurses to care for patients. And so I would definitely just mention that the VNA is doing a lot of work behind the scenes to look at staffing and the staffing crisis. And please note the language I'm using on this, right? I'm intentionally not saying nursing shortage, because you know what, we have a lot of nurses under grueling conditions if they don't feel like they're supported. And so it's not necessarily a lack of nurses, it's a lack of staff, right? And so we need to make sure that we're taking better care of staff so we can keep nurses in the profession, not lose them to other areas of work. And so we're doing a lot behind the scenes to try to help fix the staffing crisis. Let me scroll down here. Let's see, a practical question about nurses in the schools. Will they be matching policy with funding so that schools can practically afford to have an RN work for them? Well, yeah, so, you know, everything, as we know, most things in legislation comes down to money. It's all well and good to want to do something or to think something's a good idea, but you have to have money to pay for it. And so, yeah, obviously, any efforts to put nurses in schools are going to require the funding to do that. And so, you know, I don't, and I wish Andrew was here. I wish my wingman was here to answer questions. I don't actually think there's a specific bill being put forward this session about this issue because of this competition for money in the midst of a pandemic. And so, but I know it's also, you know, it's not just being tackled legislatively, but also through like the boards of education and through other regulatory mechanisms too. But yes, funding is a huge deal when you're trying to get something passed or move something through. So let's see. Muster app is not working well. After entering personal date and hitting send, nothing happens. Uh-oh. I think, was the Muster app the one, is that where we were linking for the House bill that's coming up tomorrow?
Yes, that's correct. And the way the app works, if you are not a constituent of any of the legislators on that committee, it will not send a message to them. So that's probably what happened to the attendee experiencing issues.
Okay, well, and I know I said several times, your constituency has power, and it does, but also just being a nurse has power. And so even if your legislator is not on the committee that's hearing this bill tomorrow, you can still write the legislators that are on that committee. And the way that you can do that is by going to the Who's My Legislator website. And you should be able to, you won't use your address because that would connect you with your legislators, but you should be able to find contact information for legislators that are not necessarily your legislators. And you can still send them a letter, send them an email that says, hey, I support this, and I hope that you will support it too in committee tomorrow. That's another way that you can do it. Let's see. And there is also a way to submit written testimony on any particular bill. Do we have by chance the link to submit written testimony? If we don't, we might be able to blast it out in an email or something. I don't know that I have it offhand.
Yeah, I should be able to get that for you guys. No problem.
Awesome. Thank you so much. So, you know, when bills are being heard in committee, they send out sort of a little virtual queue where you can go in there and submit written testimony. And so that will go to everyone in the committee as well. And so that's another way of doing it. You can just simply write that you support, you know, this House bill and a quick explanation as to why. Don't make it too lengthy because it won't get read if it's too lengthy, but you can support written testimony that way. Let's see. Is there any way to find groups to join who might already be scheduled to meet with specific legislators? That's a good question. I don't know that we have any like internal mechanism to do that. But that's a really good idea, you know, for something that we could do, even if it's something as simple as like a Google Doc, right? To share, you know, who are meeting with what legislators in case, you know, although I will say when you when you schedule a meeting and you tell them the number of people that are going to be there and you tell them the names of the people that are coming, it might be difficult after it's already scheduled to add more people to that group. But if you have good input or good information to share with that group before they go in, it might be a good idea to be able to contact them. Let's
Actually,
see.
this is Ellie again. I just wanted to add on to that a little bit, kind of as you were saying, if there's a certain group that you're a member of, like the Virginia Association of School Nurses, the best thing to do would be to email them and see if they have set up anything, because all of the nursing organizations will have their own lobby days. And they certainly want as many nurses as possible to come. So I'm sure they'd be happy to have extras, but just passing that along.
Yeah, that's a fantastic point. And it makes me really wish that like I didn't have a bad habit of scribbling down notes on random pieces of paper in my office, because during our most recent VNA meeting, right, the group of all the leadership from all the specialty nursing organizations, I actually jotted down lots of the dates for the advocacy days for lots of those groups, and it's somewhere in a pile. I wish I could be helpful, but yes, absolutely reach out to any other nursing organizations to see when the lobby days are, when they plan to meet with legislators, and that's another way you can sort of jump on the advocacy train. Let's see. Oh, Valerie says, I already sent the committee an email this morning and the representative 2 days ago. Sweet. Well done. Thank you. That is good work. All right. Let's see. Looking to see if there are any more questions in the chat. I kind of like just, scroll through pretty quickly. Let's look here. Somebody is, let's see, Megan was talking about, as an ER nurse, I believe we have significantly lacked preventative medicine education to slow down the trickle of sick patients into the ED. You're absolutely right. We have a system that is reactive instead of proactive in terms of preventing disease. We deal with it downstream a lot. There's been an enormous amount of miseducation, conspiracies, particularly related to COVID. Well, you're right. There absolutely has been, and it's awful, because what we've seen through a lot of these conspiracies is kind of the erosion of public trust in our healthcare institutions, and that is problematic for so many reasons. We need people to trust public health institutions so that we can best guide them and care for them in moments like this during a pandemic. And so it's a big problem. It's another reminder for the reason, that nurses need to come with correct information, that we really need to make sure to fact check things and be able to, know that information that we're sharing is accurate, because there is so much disinformation available. And believe it or not, legislators, they are not infallible. they are just as susceptible to disinformation as anyone else. And so it's really important that we help to correct the record and make sure that we're sharing evidence-based recommendations, facts, verifiable facts with them. All right. Let me see here, what else? So safe and adjusted staffing based on patient acuity. And again, we're definitely working hard to, address the staffing crisis. And it really comes down to lots of different things. One of the biggest things is, well, we need staff to feel supported. And we need nurses to make sure that they feel like they're working in safe conditions and like they're adequately staffed. So how do you make a unit adequately staffed if the staffing is the problem? So it's kind of a big circle. One of the ways we can do that is by making more nurses, right? Graduating more nurses. And so we've been working with the Virginia Association of Colleges of Nursing, working with lots of stakeholders at educational institutions to be able to see how we can help them to produce more nurses. So one of those ways is by having lots of clinical preceptor opportunities, and not just for advanced practice nurses, right? We need to have opportunities for people in registered nursing programs to have clinical sites. The lack of clinical sites for RN programs is a significant barrier, and so that's something we're trying to get creative on and how we can solve it. Let's see, I think another message popped up down here. All right. So Any last minute burning questions before we wrap up for the day? I just wanted to remind you that we are going to send you some materials. They'll be emailed out to you within a few days that will help you along in this process. And we encourage you to reach out with any questions you might have. So Ellie Buck is a great resource for this. And of course, I'm always happy to help in whatever way that I can. And so just reach out to us and let us know how we can help you succeed and go forth and capture hearts and minds and get some good things done. Thank you so much for attending today. It is absolutely a pleasure to be with you, and I'm just really appreciative for all the good work that you'd like to do on behalf of nurses across the Commonwealth. Thank you very much.